it. So there's this doctor that was a plastic surgeon, like a legit plastic surgeon, pretty famous on TikTok. She had a little under 900,000 followers, which, I think I'm sitting at like 155, so definitely, bigger than I am on TikTok. And she got her license suspended. Yeah, it's bad. And I didn't know a whole lot about it at first. I was like, I don't want to make a big deal or dramatize someone's problems, right? Like if there wasn't anything to learn about it, like I wasn't gonna bring it up. But then some new stuff came out, which I do think is worth talking about because potentially it could help patients like avoid, a similar circumstance. So I have a little bit of video, why don't you roll that video from the news station?
The board also found concerns with the doctor's repeated use of social media. Records state by taking video of procedures, the doctor's focus was on the camera, not the patient. Board members saying, quote, Dr. Graue's continued practice presents a danger of immediate and serious harm to the public.
Yeah, that's a pretty bold statement, right? The public harm, so when I saw that come out, I was like, man, I have to dig into this. Because at first I just heard she got, her license suspended, which is not common. I mean, medical board, so that means her state medical board, I think she's in Ohio, suspended her license. That's kind of a big deal. They don't just suspend people's license for no reason.
Right.
But then when I saw that, I was like, okay, I'm going to have to dig into this and see. And so one of the things that she was famous for was live streaming surgery. And so I got a little clip of her talking about it.
Do we live stream surgery? It's Doctor Roxy. Let me give you the scoop. We do. We show our surgeries every single day on Snapchat. Patients get to decide if they want to be part of it. And if you do, you can watch your own surgery. I do this because it's sort of fun to see what's going on back there.
I don't know.
I would not want to see my own surgery. I remember when I had a C-section, my husband at the time was videoing it. And he was like, do you want to see the video? And I was like, no.
I'm a hard pass.
I don't want to see my intestines being pulled out. Thank you, though.
Who wants to see that? So, I mean, some people like to see, their surgeries. Some people don't care, but then other people want to see their surgeries.
Yeah.
So she was live streaming surgeries, which, I have to say that's a bold move. It's something that I've thought about doing, but I just never have because there's some potential issues with doing that. Dr. Miami have you guys heard of Dr. Miami? Okay, so Travis knows Miami. So he's probably the most famous social media plastic surgeon. He was doing that on Snapchat long before this girl. And anyway, so I'd seen her videos on TikTok and I don't know, for me, they were just a little bit too much. I granted, firing a breast implant out of a cannon is probably not the most professional thing ever. But it's, I don't know.
But you're not potentially putting a patient.
Well, true, right? But some of hers were really silly. Roll that next clip. I just don't do that stuff on my videos. I'll beat up implants, but I don't know. It just was too much for me. So I never was a huge fan of hers. I don't know. Something about her videos just turned me off. But the surprising part, right? So I'm getting to the surprising part, right? So she was suspended. Then of course, once that happened, which is pretty common, a lot of people started coming out of the woodwork saying, oh, Dr. Roxy botched my surgery. And, I kind of flipped through some of them, and some of them were normal complication stuff, it's kind of annoying as a surgeon when people have not an expected complication, but a known complication. They're oh, I was botched. Well, no, there are certain things, and for me, I always talk about breast implants and capsular contracture. It's just one of those things. Tummy tucks and healing issues on the incision is just one of those things. And so some of the people coming out, talking, bad about her, maybe didn't have legit things, but then I saw some of the stuff that actually was legit. And so what came out was that she had at least 2 patients that when she was doing liposuction, she perforated their intestines. And we've talked about that. It was, remember Hank Williams Jr.'s wife died from that. Were you here for that episode, or was that right before you got here?
I don't remember.
We've done so many episodes now. So Hank Williams Jr.'s wife literally died from that exact thing. So when you do liposuction, you know it's like a cannula, like a hollow rod, and it actually went too deep and got on their inside, like in their, well, for her it was her lung, but in these patients it got their intestines and actually perforated their intestines. And the worst part, like, I mean, let me just tell you that complication is like the biggest fear of anyone doing liposuction. However, it should be exceedingly rare to the point that the majority of plastic surgeons never have it happen in their career. Like it shouldn't happen if you're paying attention, being safe. It shouldn't happen. Now, could it happen? Could it happen to me? Yes, it could. I mean, it never has, but it could happen. But the problem is those two patients that happened to, she was live streaming the surgery, and the complaint is that she wasn't paying attention. So roll that next video.
Full out conversation.
Right. So I saw that video, and like as a plastic surgeon, that video gives me chills because she's liposuctioning someone's neck in that video, and you can even hear her talking about, oh, there's some very critical structures here that we don't want to, like, you know, injure, while she's looking away and very forcefully doing liposuction. Like, so liposuction, you know,
Scary.
like, I mean, when I do it, like, I mean, you have to put some pressure on it, but like,
There's like some finesse.
there's some finesse
You
to
don't
it, and
have to,
like her,
jab
the way
it.
she was jabbing to me is reckless. Like, I mean, that's super, super aggressive, especially in the neck, like where if you go too deep, like you're literally gonna,
There's a huge ass artery right here.
yeah, you're gonna kill that patient like within a minute if like you get too deep. And that wasn't a patient that had a problem. That patient did fine, but like for her to be looking away from what she's doing and talking and being that aggressive, like I have huge problems with that. Like,
Yeah.
I mean, and obviously it didn't work out because, you know, she had two patients that had bowel perforations from her doing exactly that. And so that's why they pulled her license, and I think justifiably so, given that. Like, I'm kind of lukewarm on live streaming surgery. I think it can be done safely, but that's not it. And then the other big complaint that they had against them, which I really have a problem with, is apparently her and her office were telling her patients, when her patients were concerned and said, I want to go to the ER, they said, no, don't do that. Don't go to the ER. They're not going to do anything for you. And I do have a huge problem with that. And I tell this to my nurse in my office, and if she was here, she'd say the exact same thing. If a patient tells you they want to go to the ER, you tell them to go. If it's so concerning to you that you want to get in your car and go to the emergency room, even if I don't think that it's probably a problem, that patient should go to the ER. And so she had patients where they had these, you know, issues, and her office told them not to go, and then they went anyway, and they had like these life-threatening issues. And so, you know, that's just another reason why I feel like that this is absolutely a justifiable suspension. So, yeah, it's unfortunate. I mean, you know, once again, I don't want to kick people when they're down.
Yeah.
But I mean, you know, people like that do stuff are not good for us as a profession, as plastic surgeons.
It sounds like she just got too caught up in that life.
I think you're right. I mean, I really do.
She's too focused on like fame instead of
yeah.
her.
And you know, and someone
her
might look
skill.
at me and be like, oh, well, this guy's, you know, doing the same thing. Well, I mean, no, because like, you know, there's a time for being the talk show host, and there's a time for, you know, doing my social media stuff. But that's not like when I'm doing something that.
And I think a lot of the content that you post, like, is for like educational. You know what I'm saying? Like, you give medical facts behind things. You have a reason for why you are actually doing certain things. It's not just you
like
dancing to Meg Thee Stallion.
Yeah, you're not doing like
ER
TikTok
room.
dances.
Yeah,
I refuse to
it's not
do.
that. It's not
In
that.
your surgery
Nobody
room.
wants to see me dance. And now listen, I'm a good dancer. Like, I grew up in the 90s, man, in the club scene. I can dance, but I'm not doing it for social
I didn't
media.
say I didn't say nobody wants to see it. I just said you
Sarah,
don't post
We're
it.
having a dance off sometime.
I can't dance.
Oh, you can't?
I mean, I can, but it takes liquid courage.
We can arrange that. All right, so I guess next is what's going to happen to Dr. Roxy, right? Her license suspended. So she has a hearing in May of next year, which means like for the next 6 months, she's out of business.
Couldn't
And
she like go somewhere else? Can she like move? Go to another
there's
state?
no way she could get a license when she's under investigation. She couldn't get a license, not in the United States. No, that's an impossibility.
Well, I guess she's gonna have to make some more TikToks.
all of her. So she went dark. So I wanted to go get some of her other videos because like there's some ones that are like pretty bad, but she went dark. Like all of her stuff is like down right now, like on social media, all of it, like her TikTok, Insta, YouTube, all of it. Yeah.
Nice.
I personally think. I mean, I don't know this. I personally think she's in big trouble. Like, I mean, as far as like her career, you know, I mean, this one's going to be hard to bounce back from. I mean, I don't know. We'll see what happens.